Hi everyone, it's Dr. Denny over at Fourpaza at Fulshire Veterinary Clinic, and today we're going to be talking about everything you might need to know about fleas and ticks in relation to your dog.
Dr. Denny, how does my dog get fleas and ticks?
Well, they live outside, so every time that your dog goes outside, even if it's just to go potty, we're being exposed. Particularly in our area, we still have quite a few rural areas where we have a bunch of ticks and tick-borne diseases and fleas. I don't care if your dog is going for a short walk. I don't care if your dog is quote unquote an indoor dog. If they are going out to potty, they're being exposed.
Can fleas and ticks spread from my dog to my home and family?
Absolutely. And I think that's, a big part of, protecting, human health. And that's part of what a veterinarian's job is yes, we take care of the animals, but by taking care of the animals, we actually protect humans as well. So when you're outside and your kids are running around and playing around, it is possible for fleas and ticks to get on them, to bring them into the house. The same goes with your dog. And once they're in the house, then yes, they can get onto your clothing. They can get onto your children. Fleas don't necessarily like humans that much, so they're usually not going to bite us unless we're a last resort. But ticks absolutely will. And with ticks comes tick-borne diseases, which can become life-threatening.
What health problems can fleas and ticks cause in my dog?
So fleas and ticks are blood-sucking parasites. So the first one we can see is anemia. So sometimes we'll see puppies come in that are super duper anemic. And sometimes even so bad that those animals need blood transfusions. Secondarily, we can see intestinal parasites with fleas. That is the only way that your dog can get tapeworms, is by ingesting a live flea. Also, tick-borne diseases. So Lyme disease, Ehrlichia, Babesia. But Lyme disease is probably going to be our big hitter here. That's the one that everyone's going to be the most knowledgeable about, but that is the most high risk, especially for your family.
How effective are flea and tick medications?
Super effective when they're prescription strength and they're oral. So I will say that a lot of the topicals don't work as well as they used to. So once upon a time, a long time ago, our topicals used to work really well, but they've been on the market for so long that we are seeing flea and tick resistances. So often everyone has switched over to oral products, and orals are going to be the way of the future.
What will my veterinarian recommend for flea and tick treatment?
So what we carry here is we like Bravecto. That's one of them. That's an oral chew that lasts for 12 weeks, about 3 months of good flea and tick control. We also have Simparica Trio, which is an all-in-one, does heartworm, fleas, ticks, and intestinal parasites. Those are going to be the two ones that we carry in the hospital. There are other options, of course, but they're all basically in the same drug class.
How can I identify fleas on my dog?
So they're really hard to see, actually. I hear this all the time. My dog doesn't have fleas, because if they come in itching and chewing, one of the first questions I'm going to ask if we're not on flea prevention is, how long have we been off flea prevention? And then the owners are going to say, well, my dog doesn't have fleas. I would see them. And that's actually not really true. They're teeny tiny, they're fast, and you're really not going to see them unless you have a really heavy infestation. So even a few fleas could be causing an allergic reaction. So sometimes you will see it, and you might see the signs of fleas. So like if you're seeing little black specks of like dirt on the skin of your dogs, that could be flea dirt, also known as flea feces. So that's one thing to see, but most of the time you're not going to see anything.
How can I identify ticks on my dog?
You will see them. I'm gonna go ahead and say that I'm a big baby when it comes to ticks. I will put my big girl panties on and remove it from a patient. I loathe ticks, but they are little small round beetle looking things, and they're like stuck. And you have to make sure when you remove them that you get the entire tick. The head does embed into the skin, and you want to make sure you don't leave anything behind.
What should I do if I see fleas or ticks on my dog?
So first of all, I would probably call your veterinarian, and let's go ahead and get seen, and let's get some flea and tick prevention on board. And then we really do need to talk a lot about environmental control. Getting your yard treated, your house treated are going to be really important. Washing linens where the dog spends most of their time. If you have cats in the house, get them on flea prevention and tick prevention. So environmental control is going to be really important. Also a longer discussion to be had with your veterinarian.
What different types of flea and tick preventative treatments are there?
So there's topicals and then there's orals. Okay, clearly I am more of a fan of orals. I feel like they work better and faster, and we don't see as many resistances that we do to the topicals. Flea and tick baths are like not a thing. It will literally help for 2 hours. 2 hours. I don't think it's, I mean, if you have a puppy or a kitten or whatever, we also have to be really careful of toxicity. But it's, I mean, if you have nothing else available to you, that with a flea comb and a pair of tweezers. But that is just not the most effective use to try to get the fleas and ticks off your pet. Okay guys, I hope this helped answer some questions that you might have about fleas and ticks. If you do think that your dog has fleas or ticks, or if now after listening to this video, you're like, oh, I didn't realize they're getting exposed even when they go out to potty. My dog's only out for 5 minutes, but Dr. Denny's telling me that, hey, they are actually being exposed. Maybe I need to get my dog on some flea prevention. Please give us a call and we'll get you set up with an appointment. Thank you.
I love this.
Yeah, it's nice.
Oh, man.